If you have heard that Medicare will cover weight loss drugs like Wegovy or Zepbound for $50 in 2026, do not ignore it. There is a real Medicare change here. But do not assume it means every Medicare patient can walk into a pharmacy and get any weight loss drug for $50. The official language is narrower than the headline. CMS calls this the Medicare GLP-1 Bridge. Starting July 1, 2026, it is meant to give eligible Medicare Part D beneficiaries access to certain GLP-1 drugs. CMS describes it as a short-term demonstration, running through December 31, 2027. So the first thing to understand is this. The $50 number is real, but it belongs to a specific temporary program. The beneficiary page on Medicare.gov lists the drugs this way: Foundayo as a tablet, Wegovy as an injection or tablet, and Zepbound as the quick pen only. It also says the program does not cover single-dose Zepbound pens or Zepbound vials. That matters because a small wording difference can change whether the program applies. The next question is eligibility. Medicare.gov says you need Medicare drug coverage, often called Part D. You also cannot already be getting a GLP-1 drug covered through your Medicare Part D plan. There is another important catch. The bridge is not for people who have type 2 diabetes, moderate to severe sleep apnea, or fatty liver disease through this route. Medicare.gov says your Part D plan might cover GLP-1s for those conditions, but that is separate from this bridge. Then come the health criteria. Medicare.gov says you must be at least 18 and meet BMI and condition rules when starting GLP-1 therapy. A BMI of 35 or more may meet the threshold by itself. A BMI from 30 to 34.99 requires certain conditions, such as some heart, blood pressure, kidney, prediabetes, heart attack, stroke, or peripheral artery disease criteria. A BMI from 27 to 29.99 has a shorter list of qualifying conditions. That is why this should be a doctor and pharmacy conversation, not a guess from a headline. Now let us talk about the $50. Medicare.gov says you pay a $50 copayment to the pharmacy for a 1-month supply, either 28 or 30 days depending on the drug. But CMS and Medicare.gov both make another point. This does not work like ordinary Part D spending. The copay does not count toward your yearly drug deductible or out-of-pocket limit. It will not appear on your Part D explanation of benefits. It cannot be lowered by extra help. It also cannot be spread across months using the Medicare prescription payment plan. In plain English, the monthly price may be simple, but the accounting around it is not the usual Part D path. Here is the calm way to check it. First, go to Medicare.gov and search for weight loss drugs, or look for Medicare GLP-1 Bridge. Second, ask your healthcare provider whether a GLP-1 drug is medically appropriate and whether you meet the listed criteria. Third, have the provider send the prescription to the pharmacy and complete prior authorization when requested. Fourth, watch for confirmation that the drug is covered under the Medicare GLP-1 Bridge. And if anyone calls, texts, or emails you saying they can enroll you instantly, be careful. Use Medicare.gov, your plan, your pharmacy, your provider, or 1-800-MEDICARE. Do not send your Medicare number through a random link. The bottom line is simple. Medicare's $50 GLP-1 change is real, useful, and worth checking. But it is not automatic. It depends on the program rules, the exact drug and format, your Part D situation, prior authorization, and your health criteria. Before you make decisions, verify it from the official source and talk with your provider.